Hello, my name is Adrianna Maestranzi, and this is my media project milestone presentation. So I chose to do Grey's Anatomy, specifically season 2, episode 3, and this is an episode called Blues for Sister Someone. This is about a patient who asked Dr. Edison Montgomery, who is a doctor in the show, to secretly tie her tubes during her C-section. Her husband, the patient's husband, is a devout Catholic and strongly opposes from any form of birth control. And the wife, she fears that her husband will have a bad reaction if she chooses to tie her tubes. Dr. Edison respects her autonomy and agrees to do the procedure without informing her husband. However, Dr. Alex Karev, another doctor who works at the hospital, who assists during the surgery, hints to the husband that there was a complication, which eventually leads to further conflict. The dilemma in this situation is right versus right. On one side, we have the patient's right to autonomy to make her decisions about her own body without interference. On the other side, her husband has a right to be informed about significant medical procedures, especially those that impact their family's future. The conflict lies in how to balance the patient's confidentiality with her husband's expectations in the relationship, which raises complex ethical questions and trust about medical responsibility. Stakeholders. So there are 5 stakeholders that I found within this dilemma. The first being the patient who wants control over her reproductive health. The second is her husband, whose religious beliefs makes him opposed to birth control, which would be tying her tubes. Third, Dr. Addison Gray, who is committed to respecting the patient's autonomy and who performs the procedure. Fourth, Dr. Alex Karev, who eventually breaks confidentiality by hinting to the husband about the C-section, tying her tubes during the C-section. And finally, the hospital itself is a stakeholder, as they could face legal action if the husband decides to sue after discovering the truth. The first side of the situation um, is patient's autonomy. She has the right to make decisions about her body, and she clearly wants to stop having children. The importance of respecting her confidentiality is like a central idea here, since she explicitly requests that her husband not be told. Dr. Edison Gray's decision to honor this request demonstrates her respect for the patient's wishes, prioritizing the patient's well-being and her bodily autonomy. The second side is the husband's rights. The second side of this dilemma would be to inform the husband, since he is deeply involved in the family's decisions, and not telling him about such a significant procedure could be seen as undermining trust in their marriage. Additionally, given his strong religious beliefs, with ultimately withholding this information could cause emotional harm if he discovers it later on. From his perspective, being excluded from such an important decision violates their marital partnership. So the best side to this decision, well, both sides have valid ethical claims. I believe the best side of this dilemma is to ultimately support the patient's autonomy and wishes. The ability to make decisions about one's own body is fundamental. And in this case, the patient is clear about her wishes to not inform her husband about tying her tubes. Dr. Addison Gray's choice to respect her autonomy prioritizes the patient's bodily integrity and mental well-being. Though the husband's feelings are important, the patient's right to control her own reproductive health and to make decisions about her own body should take precedence overall. So theory number 1, I chose utilitarianism. Utilitarianism evaluates actions based on their outcomes, aiming to produce the greatest good for the greatest number. By honoring the patient's request, Dr. Addison Gray is promoting her overall health and well-being, which is a positive outcome. However, utilitarianism also requires us to consider the potential harm to the marriage if the husband discovers the truth. Balancing these consequences is central to the utilitarian analysis of this case overall. Theory number 2 is the deontological ethics. From the perspective of deontological ethics, which focuses on duties and moral rules, Dr. Addison Gray has a clear duty to respect her patient's autonomy. According to this theory, it is her responsibility to follow the ethical rule of the patient's confidentiality, regardless of the overall consequences. These ethics suggest that protecting the patient's privacy is the right action, even if it might cause issues later. For example, with this situation would be with her husband and her husband getting upset about her tying her tubes. Theory number 3, I chose to do natural law. The natural law theory, often linked with religious beliefs, suggests that actions are moral when they align with natural human purpose, such as procreation. In this situation, the husband's opposition to the birth control is rooted in his view of morality, which is based within his religion. This conflicts with natural law concept of reproduction. However, in this situation, the patient's wishes conflict with this perspective, highlighting the tension between religious mortality and individual autonomy in this case. So for principles, the first principle I chose to do was autonomy. The principle of autonomy, I believe, would be very central and critical to this situation. The patient's right to make decisions about her own body without interference is a fundamental ethical principle. By the patient choosing to tie her tubes, she's exercising this right, and the doctor's accent gray, her decision to support her demonstrates a clear commitment to respecting autonomy within medical practice. Principle number 2, I chose to do beneficence. Beneficence, yes. The principle of beneficence requires doctors to act in the best interests of their patients. By ultimately tying the patient's tubes, the Dr. Addison Gray, she is relieving her of this burden of future pregnancies, which the patient overall feels that she cannot handle. This will ultimately improve the patient's quality of life because it will reduce both her physical and emotional strain, which ultimately aligns with the principle of beneficence. Principle number 3 is non-maleficence. Non-maleficence means to do no harm, which is also relevant in this case, I believe. This is because Dr. Addison's actions to benefit the patient, there is potentially emotional harm to the husband if he finds out about the secret procedure. Additionally, though, Dr. Alex Karev's breach of confidentiality by hinting the truth to the husband risks causing harm not only to the husband, because he will endure emotional harm from this, but also the trust within the marriage. Yes. The fourth principle I chose to do is justice. Justice refers to fairness in medical decision-making. And in this case, the patient's wishes are prioritized, but there is a question of whether it is just to exclude the husband from the decision. From one perspective, fairness is achieved by respecting the patient's autonomy, but from another, justice might require considering the husband's role in their shared life. The first concept I chose to do is consequentialism. Consequentialism focuses on the outcomes of actions, and in this case, the outcome is clearly positive for the patient, as her reproductive autonomy is respected, but potentially negative for her marriage if her husband ultimately discovers the truth of her tubes being tied. Consequentialist analysis would involve weighing the benefits to the patient against the possible harm of her relationship. The second concept I chose to do is virtue ethics, which emphasizes the importance of moral character and decision making. Dr. Edison's decisions to disrespect the patient's autonomy demonstrates compassion and integrity as her role of a doctor. And on the other hand, Alex Karev's decision to hint at the truth shows a breach in his moral character, as it undermines his trust and confidentiality as a doctor to his patient. And then finally, the third concept I chose to do is feminism. From a feminist ethical perspective, this case highlights the importance of supporting women's reproductive autonomy. By honoring the patient's wishes to tie her tubes, Dr. Edison is empowering the patient and challenging the traditional power dynamics in which her husband would have control over his wife's reproductive health. But the feminist ethical perspective supports that Dr. Addison Gray does respect the wife's decision to tie her tubes because this is her right as a woman to for her own reproductive health. Yes. Finally, for like my personal perfection, and reflecting on this episode, I believe it does realistically portray the complexity of medical ethics. I believe it shows how doctors must like navigate difficult and conflicting ethical principles and real life situations like these that, a physician in an everyday hospital may come across. The importance of respecting patient autonomy stands out to me as a key takeaway. And this episode highlights how it is vital to honor a patient's rights, even in the face of complex relational dynamics, which in this case would be the marriage and the religious beliefs that this couple has. And yes, that's the end of my presentation. Thank you so much.